It sounds like there's a lot of changes happening in the field of primary care, almost like a primary care revolution. Tell me more about that.
Well, I think we absolutely are in the midst of a primary care revolution. And the primary care revolution is really going to be driven by value-based care. We have to produce better outcomes for our patients and for society, because $1 in $5 in the U.S. economy is being spent on healthcare, and about 1 in 4 of those dollars is being wasted. If we could save 1% of the waste in healthcare in the U.S., just 1% of the waste, not all of it, just 1% of it, we would have enough resources to pay for preschool for every 4-year-old in the country. Physicians are going to need to focus more on high complexity patients. You look at what CVS Aetna is doing with Minute Clinics. You look at what Walmart is doing with their health centers. I think the lower complexity illness is going to be cared for by people who can do it cheaper. And the physicians are going to need to buckle down and take care of the sicker, more complex patients. It's still going to be about relationships. That's the problem with the fee-for-service model, is there's not a CPT code for a doctor-patient relationship, and there's not a CPT code for keeping a patient out of the hospital. You get paid a pretty high level of a CPT code for doing an admission workup, but you don't really get paid if you help the patient stay out of the hospital. And then we really have to prioritize coaching for health versus consulting for sickness, meaning we've got to work with people to help wherever they are on the sickness and wellness continuum. We've got to help them move more towards wellness. So I think that's going to be the key for the primary care revolution going forward.
It's true. As it stands right now, in the fee-for-service model, you don't get paid to take care of a healthy patient.
Right.
And that's what we want. And we want our patients to be healthy. We want them to stay well, but it's kind of almost counterintuitive, because if they're healthy, then they don't come in and see us, and then we don't get paid. And so this value model sounds very promising.
Absolutely. And it aligns the incentives perfectly, because we only do well if our patients do well.
So earlier you mentioned that 1 out of every $5 spent in the U.S. is on healthcare. And of that lump sum, 1 out of every $5 is wasted. Can you talk more about that?
Sure. If you look at how we compare to healthcare in other countries, we have some of the most expensive healthcare in the developed world. And if you actually look at longevity or health outcomes, we actually get some of the just very middling. So part of it is we have a system where people have to pay for their primary care. I've always used the analogy that paying for primary care is analogous to us as a society putting quarters on the dashboard of cars and making people pay to put their seatbelt on. I mean, it just wouldn't make sense from an insurance standpoint, because seatbelts save so many lives. People who engage in primary care and take care of problems before they develop a heart attack or stroke are obviously a whole lot easier to care for.
For us, by us, and just for us, this is Hope for Med.